Hi, I'm Dr. Katie Thompson with the Health Improvement Center, and I want to demonstrate what I do for concussion and TMJ. So this is Matt, and Matt fell out, or actually ran into an air conditioner when he was 8 years old. And you hit it where? Right there. Right. So he probably had a concussion from it. So what I do is I do muscle testing to find out what bones in the skull are out. So just hold your arm here and just match my pressure. Good. So what I'm going to do is I'm going to put my hand on his skull. Oop, well, and it's weak. Hold. Nope. All right, so we've got the bones on the side of his skull are showing some problems, so I'm going to fix those. This bone here is called the temporal bone. It makes up part of the TMJ joint, and when this bone is out of alignment, it can also affect the alignment of the jaw. Okay, so if we look at this skull, you can see part of it right here. That's part of the temporal bone that attaches into that TMJ. So I'm going to, again, I'm muscle testing here, and his arm goes weak, so I'm going to actually fix that by just doing some gentle pressure on that joint. I'm opening up the little suture line. A lot of people think that the bones in the skull don't move. They actually do. And this works great with an infant. So hold there. I'm going to put my hand here on the temporal bone, and it's actually fine. Now, I'm also going to do another test to see if there's any other cranial bones I need to work on. So I'm going to press his skull together, and then I'm going to test the muscle, and that's fine. Now, the concussion needs to be handled in two ways. It needs to be handled structurally, but it also needs to be handled nutritionally. If you've seen football players, when they get hit, that's a concussion that they're getting. And you notice that a lot of these football players are starting to have damage to their brain. They're starting to have brain difficulties. Look at Muhammad Ali, for example. He had a lot of health issues post all the blows he took to his head while he was boxing. There is nutritional support that needs to be in place to help heal that. Because when you have an injury to an area, the body sets up an interesting reaction. The body will actually attack those cells in his brain. Or let's say you have a heart attack. Those dead cells set up an immune reaction called an autoimmune reaction and make the body attack the heart cells, or in this case, attack the brain cells. So there's actually nutritional support I give people when I find out that they have a concussion. So we're going to check his jaw, because anytime someone has a cranial bone issue, you know that the jaw is going to be involved. Hold here. He's also had some major dental work, so that can also be a problem. So what I'm doing is I'm just putting my fingers right on that jaw. And if it's a problem, it goes weak. So now I'm going to use my activator, and I'm just going to adjust that right there. That wasn't too difficult, right? Okay, so strong. Now I'm going to have him open his mouth real wide. Good. Nice and strong. Open wide. Good. Now clench. Good. So I want to show you something. So this is the skull as if you took the brain away. You see this butterfly bone here? That sphenoid bone makes up part of the jaw. So when that bone's involved, I can check that from inside the mouth. So what I'll do, without taking this jaw apart, I can open the person's mouth and I'll push up on the hard palate. And that makes up part of that TMJ. So we're going to do that with him. So put your thumb on the roof of your mouth towards the back on the left-hand side. So again, if that's a problem, that muscle will go weak. It's not. Put it on the right-hand side. Hold here, and it's fine. So we're going to actually pretend here. Put it back on the right-hand side. Imagine if his arm went weak. Relax it. Just pretend. So then what I would do is I'm going to put a finger caught on, and I'm actually going to go in his mouth, and I'm just going to push up onto the hard palate, which is that sphenoid bone. Okay, and so what I'm doing is I'm actually helping the sphenoid bone to that butterfly bone that you see right here work like it should, because it makes up the eye socket and it also makes up the jaw, the TMJ. So people with TMJ can get clicking in the jaw. When I was having TMJ issues, my jaw would actually get stuck open, and I would just have to calm down and let it relax, and it would close. So that's what we would do for the TMJ. We just muscle test to see what's going on. Now, in addition to that, there are muscles inside the mouth that I'll need to work on. And then also the temporal muscle, because this temporalis muscle attaches right into the jaw. The other one we need to be aware of is the masseter. You know, when you chew, that muscle that moves, it goes along your jawline and it attaches right up in here. So if it's a problem, it can also get in spasm, and I can find knots in the muscle in there. His are pretty good. Wow, I spoke too soon. Tender there?
A little bit.
Okay, so he's got a little bit of spasm in the masseter muscle on the right-hand side. The one additional thing I need to look at is anytime I see concussion or TMJ, I've also got to look at the neck, because you can get a concussion from whiplash. So what I'll do is I'll muscle test again and I'll check his vertebrae. So I just pushed on his first cervical vertebrae and his arm went weak. So now we're going to push it in one direction. I'm going to push it in another. So in this case, I'll just use the activator. I'll adjust the first cervical vertebrae, come back and retest, and it's fine. The reason I need to make sure that that first cervical vertebrae is in alignment, because when that first cervical vertebrae rotates, it'll rotate and get in the way of the TMJ. So when someone tries to open and close their mouth, that first cervical vertebrae is moved, and will throw out the whole alignment of the jaw. So that whole jaw alignment will be off. If you have normal TMJ, your jaw will just open and close. Someone with abnormal or a problem with their TMJ, they'll kind of get a clicking noise, or it'll open kind of crooked like that and close like that. That's a little bit more of an exaggeration. Old spine. This is Ernie, by the way. So that's basically what I would do for TMJ. The concussion really needs a lot more nutrition, as well as checking all the cranial bones in the skull. So if you've had a concussion, want to talk with me, I'm happy to do a 15-minute phone consult to see if I can help you or your child. Just comment below the video or call me at 703-242-7474. Again, I'm Dr. Katie with the Health Improvement Center, and thanks for watching.